Thank you indeed, Swadeep, and congratulations to both Businessworld and to the Virtual Hospital for this fine initiative to create this opportunity to discuss such an important initiative taken by the Government of India. We in the ICRC, I am personally deeply honored to be able to participate in this event. It's such a great privilege for us from the outside to come, primarily to come and learn and to listen and to acknowledge the plans and processes that are put in place here. Let me start by acknowledging indeed Honorable Ashwini Chaubey, the Minister of State within the Ministry of Health and Family Welfare. Dr. Vinod K. Paul, thank you, sir, for such a very clear presentation. Mr. Rakesh Shukla from Healthcare, SME, and of course, both Mr. Anurag and Swadeep, and all the distinguished guests and healthcare providers that we have in the room. Having said that we're here to listen and learn, I should at least say a couple of words about who we are before I start. So a little bit of background about the Red Cross. We are born from the action of providing emergency healthcare at times of crisis. So born on a battlefield in Europe about over 155 years ago. And the response was led on that battlefield not by the Red Cross, not by a non-government organization, and not even by a government organization. It was led by a businessman who saw that there was a gap in the system and nobody responding, and mobilizing the resources around him at that time. From there came the idea of the volunteers of the Red Cross or the Red Crescent movement, the establishment of national bodies such as the Indian Red Cross, or the Saudi Arabian Red Crescent, or the Japanese Red Cross, and the idea of having an international body such as the International Committee of the Red Cross, our own, that would help provide expertise and legal frameworks that would support the provision of humanitarian assistance. So what is an emergency healthcare provider doing here in your healthcare summit, where such a far-sighted development project for the universal healthcare is being launched? Let me first and foremost say that we will not respond to emergencies if we don't have basic systems and procedures in place. And the great strength that I see immediately in the presentation of this morning was not only all of the care and thought put into the different levels of implementation and control and partnership and access, but also the fact that what we're trying to build is a system that allows for the strengthening of basic primary health care. We know as emergency responders that we fail when there is no resilience to the base system. We know that communities fail to recover quick enough and development is held back if we don't respond to emergencies quickly enough, or, as the previous speaker identified, we let people fall back into poverty because of a healthcare crisis. So in that sense, we've come to learn and understand exactly how this new initiative will take care. We've come to congratulate the Government of India and those who've designed this program for their initiative to try to roll out stronger universal healthcare, and we look forward to learning how that can work. We also look forward to learning how we can contribute in one way or another. In our work across 80 different countries in the world since 150 years, with $2 billion worth of programming every year, we learned a few things about healthcare. And we learned some of the things that were highlighted already in this morning's presentation. And I would again congratulate the design that's been put in place here in terms of all the different components that have been thought about. We learned first and foremost that every system tends to fail if it doesn't think about access and awareness. The best designed vehicle is useless if there are no passengers. So the accessibility element and the last mile delivery element, so the beginning and the end of the chain for us are crucial, and I think you heard a lot about that already. The focus on screening and referral, the focus on making sure that there's prevention in place, and the focus on building capacity across all of the different systems, I found very, very important. As an independent, neutral agency responding in emergencies all across the world, you may have the perception that we do a lot of direct delivery ourselves, because direct delivery is fast, and in an emergency you need speed and you often need independence to make sure you pick up everybody who may be left behind. But the reality that most humanitarians will never tell you is the majority of our work is still done together and in support of the existing systems. And if there is no capacity on the ground, if there is no framework that is already built and sustained, the ability for an outside organization to come and support is vastly reduced. And we can come and set up high-tech surgical hospitals within 48 to 72 hours anywhere in the world. And they cover a tiny, tiny proportion of the people who really need help. So the much more effective way for us to work is only in partnership with existing systems. And those systems are very often, first and foremost, and by far the majority, the government infrastructure that's in place, and, as was mentioned before, the primary healthcare infrastructure that's in place first and foremost. So again, I'm very encouraged by the pillars that have been established and the mechanisms that people are looking at for the rollout of this program. But we also end up collaborating with whoever is on the ground, able to provide the service. And I think the appeal that was made again in the presentation before, to make sure we all look at how we can play our role in such services and how we can meet standards together in such services. So a couple of other elements we learned through our operations globally was not only that accessibility was super important, the quality and the continuity of what's provided is equally important. It's not good enough to roll out large-scale, poor-quality services. It often leads to worse results than not taking the initiative in the first place. And building quality is a long-term collaborative exercise of exchange, of standard setting, and of regulation. And I was very pleased to see some of those elements already there, and I think probably in some of those areas of exchange of expertise, we are here both to learn from India's plans and performance and to share what we've experienced elsewhere where it can be of use. It's not lost on us the size of this country and the complexity and diversity of this country and the need for any program to have flexibility to adapt to that. Again, that was presented in the presentation we heard this morning, and we look forward to seeing how that works. The only way that we as the ICRC can make any kind of useful contribution to a country the size and scale and complexity of India is to work with partners. And our principal partner is, of course, the Indian Red Cross. So I just want to mention a couple of things before I close that they are doing, which I think in some ways complement and support some of the messages you heard this morning. The first one is that the Indian Red Cross has over 1,100 structures across every state and district in this country, with a pool of volunteers already trained on some basic primary healthcare messages and on first aid. That's a vehicle for passing awareness and for referring concern. But the biggest collaboration we have together with the Indian Red Cross and now also together with the National Disaster Management Authority is to make sure we also have an ever-growing pool of trained first aiders at the community level. One of the exciting projects, also blessed by the Prime Minister's office, is the rollout of first aid programming and certification for students in every school in India. That's another building block in this attempt to make sure people are not left behind and that both preventive information is provided but immediate response is available for anybody in any community, particularly the most vulnerable, that other systems may not reach. So we're very proud to be partners of both NDMA and IRCS in those endeavours, and we're very proud to work with the Ministry of Health on other support. We run specialist course on dealing with health emergencies in large populations. We look at specialist surgery for trauma, exchanging with the surgical pool here in India through AIMS and other institutes. We also look at the whole range of rehabilitative post-surgery or post-crisis interventions in terms of people with disabilities, physical rehabilitation, and a whole range of innovation programs looking at new devices and new processes that might reach people at the bottom of the pyramid in the most vulnerable circumstances in India. We hope we can broaden that support. We look forward to supporting the initiative that you've been briefed on this morning. And again, we congratulate the organisers, both Businessworld and India Virtual Hospital, for their initiative in bringing us all together today. Thank you very much for your time.